If you look at the numbers behind incontinence in women, it's hard to believe just how big an issue it is. Incontinence affects more women than diabetes, breast cancer, and heart disease, but it doesn't get nearly the attention it deserves. That's why the National Association for Continence has created the We Count campaign to help you realize that this isn't just a you problem, it's an us problem. There are treatments available right now that can make a real difference in your life, and we invite you to take action today. Visit nafc.org/we-count for essential facts, insights, and resources on stress and urge incontinence, overactive bladder, menopause-related leakage, and more. That's nafc.org/we-count to learn more and discover that there truly is strength in numbers.
Welcome to Life Without Leaks, a podcast by the National Association for Continence. NAFC is America's leading advocate for people with bladder and bowel conditions, with resources, connections to doctors, and a welcoming community of patients, physicians, and caregivers, all available at nafc.org.
Welcome back to another episode of Life Without Leaks. I'm your host, Bruce Cassover, and joining us today is Sarah Jenkins, the Executive Director for the National Association for Continence. Welcome, Sarah.
Thanks, Bruce. I'm so excited for this discussion today.
Yeah, I am too. This one is going to be a little different than our typical podcast. Normally, it's just us talking one-on-one with a guest, but we actually have a few people joining us today to talk about a pretty important effort. So our first guest is Tina Harris. She is the Vice President of Clinical Affairs at Tenderheart Health Outcomes, where she leads clinical monitoring and provides oversight to patient engagement teams. She focuses on things like optimizing clinical workflows and ensuring high-quality, coordinated care for patients and everyone else. So welcome, Tina. Thank you for joining us.
Thank you. Glad to be here, Bruce.
Awesome. Also on the podcast is Dr. Christine Talley. She is a nationally recognized distinguished educator in gerontological nursing and an associate professor and co-director of the Geriatric Workforce Enhancement Program at the University of Minnesota. So welcome, Dr. Talley. Thank you for joining us today, too.
Welcome. I'm also excited to be here to talk about this topic today.
And our third guest is Dr. Diane Newman. She is a nationally recognized expert in urology nursing and continence care, and she brings more than 30 years of clinical experience. She's practicing right now at Penn Medicine, where she serves as an adjunct professor of surgery at the Perelman School of Medicine at the University of Pennsylvania. So welcome, Dr. Newman. Thank you for joining us.
Thank you very much for having me. And I'm just honored to be able to talk about this topic with NAFC.
Yeah, we're really looking forward to it. We think that our patients are going to get a lot out of it, not just the listeners who are patients, but also clinicians and everybody involved with the healthcare field when it comes to dealing with urological issues. So, Tina, maybe you want to start us off by telling us a little bit about what we're going to be discussing today.
Yeah, it's just been a pleasure working with both Diane and Christine on this topic. Just a little background here. Tenderheart is a value-based incontinence management solutions company. So we support primarily the Medicaid market in helping manage incontinence care at home. Our particular focus is to give quality products to the patients and also make sure that they get coaching and education that they can then use to care for themselves at home. So we were super excited to partner with the University of Minnesota and the University of Pennsylvania. Today, we're going to share some insights from a study that we did regarding the Medicaid population and just some interesting facts that we found out about behaviors, about positive outcomes for the patient. And so that's why we decided to seek out some really heavy-weighted partners here to help us study this population.
You know, I think that the audience probably knows is that the use of absorbent pads are just so helpful for individuals to manage urine leakage. But there's so very little research on what do people use, what's the best product, are they, and I think what was so exciting about this research and what Tina and her group at Tenderheart has done is really wanted to test a program where we really try to learn what is the best product for that individual and what else can they do to maybe possibly manage or even decrease their incontinence.
Yeah, I would just like to add that as a researcher, I've done clinical trials to help improve incontinence in frail older women particularly. And they're an extremely hard group to recruit and get access to And so I was very excited to join this partnership because with the contracts through Tenderheart, they have access to Medicaid patients who actually have incontinence. And so honestly, for me, it was one of the easiest ways to access this patient population to help improve their incontinence.
This is it's a pretty important demographic that we're reaching out to on a pretty important topic. Was there not a lot of research ahead of time that already existed?
There's very little research in this area. First of all, like Chris said, this population is frail, disabled, receiving, other services, and it has a high prevalence of urinary incontinence. They probably have difficulty getting to a physician, even if they would seek out help for their incontinence. So this is a population needs to be studied, but there's so very little research on it. And it's basically because they're hard to reach, I think, right?
Yeah. And also, Diane, unfortunately, the healthcare industry isn't interested in something as simple as incontinence care, but it actually isn't simple. It feeds in a large financial cost, not only to the healthcare system, but also to the patient's lives. So there's not a lot of focus on incontinence care as an important part of a patient's care plan.
Right. Another thing I'd like to point out too, while there has been quite a bit of research done on frail older people who are in nursing homes, very little is done on frail older people who are living in the community. What's exciting about this project is the people that we targeted a lot of them actually are nursing home eligible, but are still living in the community. And so this was just a great way to access this population that needs a lot of help in this area.
So we have our demographic and we have a general idea that we're going to be talking with them to learn more about incontinence. Was there a particular overriding research question or group of research questions that really shaped how you were reaching out to them and what you were looking to find?
Yeah. Well, one of the things is that we wanted to test out Tenderheart's model. We are very unique in providing high quality products and frequent touch points to patients that involve providing care coaching for them. And so we wanted to see the impact, not only clinically in regards to their conditions, but also how they felt about it. We also studied the financial cost of having to, and a lot of listeners may be buying products out of pocket. So we wanted to identify what's the cost associated with that. Are people aware that Medicaid, if they're eligible for Medicaid, that Medicaid covers those things?
Another novel part of this program or this investigation actually is we actually don't know what kind of pads and products this population or any population for that matter is using. And so that's also new information that we're receiving about what are people using and how are they using it. And that's really important for us to understand because in many states, the Medicaid programs pay for these products, right? So we want to make sure that people are getting the right product for them and that we can understand how much product people need so that honestly, in the future, Medicaid programs can anticipate this potential cost that they're required to cover.
Also consideration for Medicare recipients as well. Medicare doesn't typically cover absorbency products, but the age group for incontinence, it is eligible for Medicare. And so hopefully this study and more studies to come will help also provide support for potential coverage in the Medicare market.
The other thing that I think is interesting that we have no understanding of is we may have certain categories of products, and actually the International Incontinence Society has terminology to describe what these different products like protective underwear or pull-ups or adult briefs or adult diapers. And what we really find is that there's like 4, it could be as much as 6 levels, long ones, light absorbency, heavy absorbency. And I want you to know that Tenderheart really tried to, get down to which exactly product do you need and which works for you. Like maybe at night when you have heavier leakage, you need a heavier type of product or a different, material or whatever. So I think there's nothing that really knows what people are doing. What is real world use of these products? And I think that that addition to the literature and to the understanding, I think is really, really important.
I will also just add to that looking at the pad usage over time, we actually saw over time that patients were using lower absorbency products. So we were seeing a real shift to more appropriate product use.
One thing that we didn't point out was that there's a lot of waste that happens with absorbency products. Most CME providers are just shipping the max allowable that will be paid out, even though the patient may only need half of that. So what happens is they end up throwing them away, or they end up selling them, right, in a flea market or, at a swap shop. And so that's an important piece too, is just to make sure that we're getting the right quantities and that we're not just shipping out product just because we're going to get paid for that. We have to think about the quality of the patient and begin to provide individualized care for each one of them.
That makes perfect sense. One of the things that I think Sarah can really talk about is how for ages, NAFC has been focused on trying to bring clarity to the idea of absorbent product standards and how you choose them and what does it mean to have something that's extra absorbent or less absorbent and all of those sorts of things. Sarah, maybe you could talk a little bit about how the NAFC is working to bring a little bit more clarity to that.
Sure, I'd be happy to. NAFC has worked for over 10 years to develop a set of quality absorbent standards for absorbent products. And, we've worked with manufacturers and healthcare professionals and managed care plans to really determine what the best approach is for this. And our current standards actually measure across a variety of different things like elasticity and re-wet rate and absorbency rate and all the different things that go into making a good quality absorbent product. And we've developed these standards and have a lot of effort into getting them approved on state Medicaid plans so that long-term care facilities and patients on Medicaid can receive the highest quality product for them, not just the least expensive.
I'd also just like to say that one of the main outcomes that we're also interested, besides just the impact of Tenderheart's program, but also looking at patient-reported outcomes. So we're looking at did patients report an improvement in their incontinence? Did they report an improvement in their quality of life related to incontinence, but also quality of life overall? And also looking at their satisfaction with the program and engagement with the program.
And what results did you find?
Well, that's the exciting part for me. So I'll start with the clinical outcomes that we found. We saw clinically meaningful improvements in urinary incontinence using a questionnaire called the ICIQ, which is standardly used in almost all incontinence research. And, it's worth saying that this group of people started out with quite severe incontinence. And we actually were able to improve their incontinence almost 30%, almost 40%. But the clinically meaningful difference, it actually exceeds what we see for most conservative interventions. So we were very excited to see an improvement in incontinence, a measure that we use in research. Also, though, 66% of participants reported that, hey, my incontinence got better or much better. So 2/3 saw an improvement. Only 5% said at the end of the program that their incontinence was worse. So those are great clinical outcomes for that. But also really importantly was the quality of life. So we used a measure called the Incontinence Impact Questionnaire. Again, we saw statistically and clinically meaningful improvements in their urinary incontinence related quality of life. And we also saw statistically and clinically significant improvements in their health related quality of life, measured with a very general measure called the EQ-5D-5L. And again, these clinically important improvements are very meaningful, especially since these were people with relatively low quality of life, whether it was related to their incontinence or general health quality of life, and then also their severity of incontinence. So we hit a really high risk group and we're able to get improvements for them clinically that were clinically meaningful.
Yes, and I think that everything Chris said shows that we really made an impact. And again, I want to stress to our viewers that this is in a very difficult group to see an impact. Like she said, they were frail, disabled, many are using assistive devices. So the point is that we're really excited about this data. And I want to stress to you too that when I said behavioral treatments, these are really education, teaching them what to do with a lot of different areas, bowel function and that. And NAFC has these resources. What we use is not some kind of just in research or whatever. They're available. And I want to stress that because, Sarah, you guys have some great educational tools there. We utilize those. And that's what was a lot of our education program. We taught at Tenderheart individuals who talk with these patients or these clients within this program and go through with them some of these behavioral treatments on the phone. So it was really to show this type of impact, I think is really quite significant.
And the other part, the last part of that is the satisfaction from the program as well. That was really high as we went toward the end of the program. The majority of the folks, the high 90s, I don't think we had anyone that was dissatisfied with the program by month 9, which was the completion of the study. So that's also important for, health plans and providers and patients to know that there is some satisfaction there. There is some level of improvement that patients are receiving from this type of program.
Now you have me really intrigued because you're talking about the behavioral things and the educational things that made up the program. But if I'm somebody who either a patient myself or a caregiver of a patient, do you have any more details or can you share any more details about what the program specifically really looked like? What took place in the program to generate that sort of improvement?
Sure. I'll start off. So like Diane mentioned, we used what we consider layman's people. They're not clinicians at all. And so one is that anyone can be taught in regards to providing the information. So we use our utilization management team. Their number one responsibility is to outreach to members and to provide that coaching. So we did a 9-month study with a 6-month of intervention discussing topics like skin health and falls and different areas that are important for someone to be able to manage their incontinence at home. Chris mentioned patient reported outcomes. So we collected information from the patient as well, their usage of the product, again, their satisfaction, any health conditions that they had. So that was the gist of the study from month 1 to month 6. And then 6 to 9, we just talked to the member, gathered additional information, and then ended the study with that. Chris and Diane, I know you have more to add there.
Well, and it's everything that Tina said. And I want to stress that Tina had kind of this program in place and she saw the benefit as far as not just, patient satisfaction, better use of absorbent products for urine leakage, but also cost savings. I think that's a key thing that we really haven't talked about yet. And the point is that we, when she's presented this to us, Chris and I got our heads together and we decided to enlarge on it a little bit. So the basis of this program had been used by Tenderheart. We just defined it a little bit better, made sure that we had all the behavioral interventions for urine leakage covered, such as bowel function, diet, fluid, and that type of thing. So what we did is we kind of made a more robust intervention with her clients. But I want to stress that this was a basis that Tenderheart had been doing. And they themselves saw, hey, we're seeing improvement in this. We're controlling costs and we're giving better care and better management of incontinence.
I'd like to point out that, so this was all telephone coaching done by the lay people. I also just want to stress how innovative this approach is and the access that it gives people. First of all, a lot of people don't even know what conservative treatments are available. And even if they do know it, they may not be able to access it for many reasons. They may have transportation issues getting to a clinic if they're lucky enough to find a continence specialist that can help them. But also, continence specialists are hard to come by and challenging to find. And so this offered a telephone coaching where they could access someone who could coach them through these conservative lifestyle and behavioral treatments that a lot of people can learn also through self-management. In a way, this coaching was helping people self-manage their symptoms, as well as getting expert consultation on the right products to use.
Yeah, and Chris brings up an important point, and I'm really embarrassed to say this as a specialist, a clinician who's been practicing for years in this field, but when when a lot of us, urologists, physicians, nurses, nurse practitioners, physician assistants see these patients, I don't think that a lot of people really ask about how are they containing or managing their urine leakage. We're very quick to say, okay, now we have medications that might help you. I don't know, maybe there's some kind of surgical intervention that might help you. But we really don't get down to, well, how do you live day to day with this? What are you using? And, I think, Bruce, you brought up about caregivers. We do note whether we were talking directly to that individual who's insured in the Medicare or whether it is a caregiver, so that we know who's really providing some of the information that we need, but who is really involved in that care. Because it's true that a lot of individuals at this level really do need caregiving, need assistance to walk to the bathroom, to even maybe wipe themselves. So, we don't do a good job, even when they come in, Chris. You're right. I mean, most people don't come forward, do they? Especially older, frail individuals. They just, I'm going to live with this. So, I can't walk that far.
Right?
So,
It's
the stigma,
right? And then a lot of times members don't know what questions to ask. They think that incontinence is just a normal part of aging because it's so common, and it's not a normal part of aging, but it is common. And there are ways that you can manage it at home. So you're exactly right, both Chris and Diane, that there's a stigma there that prevents folks from being able to engage their care providers to even have a conversation about it. And so Tenderheart and models like this can help support patients if they're not comfortable talking to their physician. We can give them tips to talk to that physician and say, this is specifically what I'm struggling with, right? And ask the right questions. And so the NAFC also has resources as well on how to speak to your doctor or even caregivers to speak to other family members about the incontinence care that's needed. So yeah, very important.
28% of our participants were actually receiving home health services. So even people who were receiving home health services still felt they had a need to improve their incontinence and found this project, the study, appealing to be in.
That's great. And this is all such good information. And I think empowering for patients to know that they actually can take this on themselves, and with, behavioral changes make a huge difference like this. I'm curious to know, did any specific behavioral techniques stand out as being more helpful than others in the study? Did you see more success with one over another, or was it more of a combination of things that folks tried?
Sarah, that's a great question because, being a researcher in behavioral therapy, I'm always asked, well, was it the toileting program? Was it the decrease of caffeine, which is a lifestyle change work? The issue with behavioral therapy, it's really a combination of all of them. And so that's how we approached it. Every week they were counseled on a different component of behavioral therapy, because a lot of us who have been in this field a long time feel that it's more the combination of all of the different behaviorals. And I'll say this, I'm not a believer that it's just your pelvic floor muscle exercises. It's just not the pelvic floor muscle. Strengthening that really will control your urinary symptoms. I personally feel it's sometimes a bladder retraining. And we had 1 week where they talked about bladder retraining and how to control urgency. So, Sarah, I'm kind of a purist in the sense it's a combination of all the behavioral interventions. And I don't know, Chris, if you feel differently about that.
No, I feel the same. And also the important thing about this is that the coaching was also very tailored to what the participant wanted to work on or had the ability to work on. And honestly, in multi-component intervention research studies, it's extremely hard to tease out which component worked. And so far, no one has even done that in incontinence research to date.
Yeah, and that's our focus. It's a combination of our coaching and also the high quality products that create the effect that we have. And whether or not it, to Chris's point, there's research in whether one over the other works. What we do know is that both of them together work, and that it's providing a service to the incontinence population.
Well, one of the things that Tenderheart was good about is we factored into this research that what individuals do during the day may not be what they do or need at night. One of the biggest problems with the frail elders or with aging is falls, usually at night. And what the event that's happening is they're trying to access the bathroom and they trip over a carpet or it's dark and they run into something. I can't tell you how many individuals I would see who ended up in a rehab center, and I looked at their notes. They slipped on urine in the bathroom at night. where they just couldn't make it to the toilet without having an accident. And the thing is that what we try to determine and what the Tenderheart kind of algorithm is, what do you need depending on what you're doing and what time of day? And I think that's an important thing. Individuals do not just use one pad for the whole day. Maybe they just need it at night. Maybe they just need it during certain times during the day. The research did look at that. And the use of products was dependent on events as far as time of the day.
I was going to say, Diane, you mentioned the different types of coaching pieces that we did. A good thing here as well is that sometimes there are misconceptions about how to care for your incontinence. So, for example, patients will think that if I don't drink anything, then that will keep me from having the incontinence or the severity. And that's not true. It actually will make it worse. Some folks aren't aware that there's medications like diuretics that can cause their incontinence to be worse. And so in having that teaching program in place, we're able to debunk those myths that patients have picked up along the way and orient them to the appropriate care for them.
Yeah, it sounds to me like what you're talking about, the program that you're describing, is not like we're introducing something that's novel or something that's maybe in a sort of undiscovered territory. It's really just sort of validating what happens when you try to address incontinence the correct and the proper way. That is, when you introduce an absorbent program that is built around the individual's needs, when you help them understand what sort of behaviors can contribute to incontinence and what sort of behaviors can help lessen the episodes of leakage, when you remind them of things like, this is how you eat, this is how you can do it, pelvic floor exercises, and this is how you can care for your skin and for your bedding. And well, when you do everything the right way, then you're going to get really good outcomes. Is that a fair assessment, or am I missing something?
I would say that's a fair assessment, but also, we know these things work. Our issue is, how do we let people know these work? How do we get to these people? How do we get people to implement these things? And I think that's the innovation of this, is the way we delivered it through telephone coaching, through a product supplier. So you don't have to go to a clinic or find a continence nurse specialist, which may not be available. So I think the innovation here really is in increasing access to what we know works.
And it's also shedding light in the community realm, the healthcare realm, for health plans and providers, that there is a way to help manage this population, because there's, again, not a lot of focus on this particular condition or the population in general. These are things that can be easily picked up, either just partnering with Tenderheart or creating something similar on your own. But the great thing is that now healthcare providers have heard patients' responses to telephonic counseling programs, and hopefully they will look at their own programs, partner with their quality management teams, and provide some level of collaboration to support this member base more.
Bruce, this really is novel. I don't know of any researcher or anyone where you have someone who's a company of a medical supplier that can supply these products, say, hey, I think we can do this better. And in such a population, I really haven't, I don't know of any, Chris, you may know some, I don't know of any in the United States where this has been tried. So in that sense, this is a very, very much a novel program.
That's outstanding. So if I happen to be either a caregiver or a patient, what can I take away from this study right now? What would your recommendation be?
So there's actually a couple, if you'll allow me to go through those. One is that you're not alone when it comes to managing incontinence at home. It is very much a condition that you can independently manage. So one would be to know that you're not alone, right? Break the stigma of it being an embarrassing condition to discuss. The second thing is to know the resources that you have. So again, NAFC has resources. Tenderheart Health has resources as well. Talk to your provider. We can provide support for, giving questions that you should ask the provider, whether you're a caregiver or the actual patient, and being able to manage the care. And then the last thing is know the coverage as well. So we talked about before that a lot of folks are paying out of pocket. Some of your listeners, maybe 80% of those are paying out of pocket for those services. And there could be some coverage under Medicaid or another plan that could help, offset some of the costs of their absorbency products. So those would be the things that I would leave specifically for the study. You're not alone. You can manage this at home. There are services that can support you being able to take care of yourself independently. Talk to your physician about incontinence. Make sure that you're on a good treatment plan. Tenderheart does not treat incontinence, but we provide solutions for people who do have incontinence. And then also just making sure you know what your resources are, know if there's coverage available for absorbency products, and just reach out and know who is available to support you in your care.
That's a perfect segue to actually ask you for a little more information about Tenderheart, about how you work with patients, help them in terms of affordability and the product selection, and how people can take advantage of the services that you guys offer.
Yeah, absolutely. The bigger part of our program is the collaboration with health plan partners. So Medicaid, managed care organizations who are supporting this population. But we also have self-pay. We also have Medicare patients. The best way to get in contact with us is either to call our free number, which you'll see that here in the podcast. You can also submit a referral if you're a service coordinator or a healthcare provider to our online portal, and we can start services that way. We also have email as well, or you can fax a request to us, and that's what will get the ball rolling on being able to do an individual assessment. Typically, we talk to the members individually because it's not a cookie cutter approach. So I want to make sure that as folks are reaching out, we tailor to the individual. Everybody's condition is not the same. And so we want to make sure we get that one-on-one time with them. So reach out to us via our website, via our toll-free number. If you're a healthcare provider, you can send us a fax or an email, and we will take it from there, Bruce.
So, and we'll make sure to put the contact information, the phone number, and the website in the show notes so anybody can click and call. But now, if I'm not a patient, but if I am a physician or a clinician, is this study available yet? Is it in preprint, or has it been published, or when is it coming out?
Yeah, great question. So Chris gave you some of the preliminary analysis that we've done. In July, which is in just a week or so, we expect to have the final results. We will be presenting that publicly. All of us have different platforms that we'll be presenting on, but throughout the summer and the fall, we will be doing some public presentations as well. We're not sure exactly when it will go into print. There's a lot of back-end things that we have to get reviewed before it goes publicly, but we will have presentations available shortly.
That's outstanding. I look forward to it. That's going to be great. Well, as you know, this is Life Without Leaks. And one of the things that we like to do before we leave is to provide our listeners with one little hint, tip, strategy, bit of advice to help them live a life without leaks. So, Tina, I'd like to turn to you and see if maybe you have one you could share with the group today.
Yeah, I think I may have mentioned it a little bit earlier, but you're not alone when it comes to incontinence, and it is a condition that you can manage successfully at home. Connect with the right people, whether they're in your community or it's a provider, or if it's Tenderheart, or even just your service coordinator if you have a managed care provider, and talk to them about the incontinence so that they can help you get the support that you need. I wanted to, also encourage healthcare partners to be more aware about incontinence. Think about the quality of care as you're thinking of programs or innovative ways to support this population. Think about conditions that actually lead to more adverse things if they're not managed appropriately. And take the time. I know in healthcare, there's so many priorities that we have, but just take the time to understand the population and don't overlook those seemingly small conditions that can lead to be bigger problems later on in the patient's life.
That's so true, and it's so important. And still to this day, I find it a little surprising how many people in the healthcare industry don't realize that, incontinence care and care for the pelvic floor is basic, essential healthcare as much as almost any other question they're asking in the diagnostic process. I mean, this stuff should not be ignored for whatever reason, because it's icky or because it makes your patients uncomfortable or you don't feel comfortable enough yourself with it. So absolutely, I love hearing that. And we hope that people do follow advice completely.
Can I also add about providers and stigma and preconceptions about what frail older people are capable of. I think that this also can help alleviate some providers' concerns that, well, they're not able to follow through, they're not able to do this, and that simply isn't the case. There's always opportunity and ability of even frail people to be able to improve this through, basic self-care and good standard management.
I love that, Chris, because a lot of times, there's surgical interventions and different things that you can do. And a person may be too old where the provider isn't comfortable doing that, but there are alternative treatments like using absorbency products correctly.
Great advice, and I hope that everybody takes you up on it. I also hope that everybody really takes to heart the lessons that this research is showing, which is if you do the right things, if you make it your job to educate yourself, if you make it your job to find the right absorbent products, if you make the effort to address your behaviors, and you don't let the stigma get to you, then you really can see a massive improvement in your quality of life, in the reduction of episodes, all of those things. So I really hope that this study not only has the effect that you guys are intending it to have, but also forms the basis of future insights that we continue to learn to continue to make the world a better place for people, regardless of what sort of incontinence issues they're dealing with. So thank you very much.
Well, we thank you for allowing us to present this research because your audience is wide and varied, and I know this will be of interest to them. So we really appreciate you having us.
Life Without Leaks has been brought to you by the National Association for Continence. Our music is Rainbows by Kevin MacLeod. More information about NAFC is available online at nafc.org.